Hello, I'm Dr. Welch, a cardiologist at Virginia Heart. Today I'll be talking to you about amyloidosis and how we treat it. Amyloidosis is a rare condition caused by abnormal proteins called amyloid that build up in tissues and interfere with normal organ function throughout the body. When amyloid proteins deposit in the heart, they combine to make fibers that build up around the heart muscle cells and within the heart valves. This makes heart walls stiff and affects the valve function and can sometimes disrupt the heart rhythm, as abnormal proteins can deposit in multiple locations in the body. Not just the heart, various symptoms can develop slowly over years, even decades. Some of these symptoms may include shortness of breath, swelling in the legs or ankles, irregular heartbeat, dizziness when standing, or for people who have had high blood pressure, progressively lower blood pressure. Often, other associated conditions appear years before heart symptoms, such as carpal tunnel syndrome, trigger finger, also called Dupuytren's contracture, and spinal stenosis causing neck or back pain, or various nerve-related symptoms. Because these conditions are so common, they're often not contributed to amyloidosis and are frequently overlooked. There are two main types of amyloid that affect the heart: AL amyloid and TTR amyloid. Because treatment depends on the specific type of amyloid, we always evaluate patients for both AL and TTR amyloidosis. AL stands for amyloid light chain and is associated with a blood cancer called multiple myeloma. In this condition, abnormal plasma cells in the bone marrow produce excessive antibodies, and these antibodies misfold and form amyloid fibers. TTR amyloid, which is more common than AL, occurs when a normal protein called transthyretin, produced by the liver to carry vitamin A and thyroid hormone, becomes the unstable protein. It twists into an abnormal shape. This abnormal structure is not recognized or cleared by the body. Over time, these misfolded proteins stick together, forming amyloid fibers that accumulate in tissues throughout the body and the heart. TTR amyloid can be hereditary, caused by a genetic mutation, or non-hereditary, which we call wild type. Hereditary TTR amyloidosis is inherited in an autosomal dominant pattern, meaning each child has a 50% chance of inheriting the condition from their parent. To evaluate someone for cardiac amyloidosis, we use a combination of laboratory testing and imaging. There are 3 lab tests we use to test for AL amyloidosis. For TTR, we perform a specialized nuclear imaging study called a pyrophosphate scan, or also called a PYP scan, which helps detect TTR amyloid in the heart. If a person is found to have TTR amyloid, we also offer genetic testing using a simple cheek swab to determine whether the condition is hereditary or wild-type TTR. Once a diagnosis is made, treatment depends on the type of amyloidosis. Patients with AL amyloid are referred to our hematology colleagues, as treatment typically involves chemotherapy to address the underlying plasma cell disorder or multiple myeloma. For TTR amyloid, we use medications that either stabilize the TTR protein to prevent it from misfolding, or a medication to reduce the liver's production of TTR. Although there are currently no approved treatments that remove existing amyloid deposits, medications designed to do so are actively being studied. If amyloidosis is being considered by you or your doctor, the team at Virginia Heart can help. We're part of a large team made up of multiple physicians, not just cardiologists, designed specifically for the diagnosis and treatment of amyloidosis. This program has consolidated the experts in the field of cardiac amyloid. Our physicians and clinic coordinators can help with the evaluation, diagnosis, treatment, and long-term care of amyloidosis. All of our cardiologists at Virginia Heart will work closely with the amyloid team to develop the best possible care plan for your heart health.